Ooh, all right, ladies and gentlemen, lovely to see you again. It's your friendly neighbourhood nutritionist, Connor Rhodes from slumsociety.co.uk, and today we are talking about metabolism. Metabolism. A word and topic that people often band around, and they talk a lot of talk, don't they, about the old metabolism. Faster, slower, this kind of business. You've heard this a lot, I'm sure, but do you and do these people who talk actually understand what the metabolism is? So that's my first bit of information for you. Your metabolism is the balance between the breaking down and the building things inside your body. It's the balance between the breaking down and the building of things inside your body. That sounds confusing at first, but it's not. What do you break down? Food. You eat food, you chew it, that's breaking it down. You digest it, you absorb it, that's breaking it down. That's breaking down stuff inside your body. And what about building things? What do you build? Well, if you eat too much, body fat. If you exercise and eat the right things, muscle, organs as well, you build, skin, stuff like this on a day-to-day basis. And now, can some people's balance between building things and breaking things down and how this happens in their body differ? Yes. So do some people have different metabolisms than other people? Yes. Can this impact people's weight loss and fat loss? Yes. Can a metabolism help some people lose weight and hinder other people from losing weight? Definitely. So can metabolism slow down people's weight loss results? It definitely can. Can it make weight loss more difficult for some people? Yes, it definitely can. Can the metabolism stop you losing weight? No. We've got to stop right there. Because if you're thinking, oh, I'm not losing weight and I should be, it must be my metabolism. I'm about to explain to you today with 3 perfect examples why it's not your metabolism stopping you. Could be slowing you, but it's not stopping you losing weight. The job can and will still be done. You just need to do the right things at the right time. So let's talk about 3 different metabolic disorders then that you might experience. Let's first talk about PCOS, polycystic ovary syndrome. A female afflicted disorder, essentially, that has direct impacts on the metabolism. And this actually, some ladies with PCOS, not all ladies, but some ladies with PCOS can have the slowest metabolisms that exist on Earth. PCOS can slow some ladies' metabolisms down by 20 to 40%. Oh my God, metabolic reduction. It's not fair. It's literally not fair. Can it make it more difficult? Yes, it can. What about low thyroid? Very common. Lots of people think that they've got thyroid issues. If you think you've got thyroid issues, you could go to the doctors, get it checked. By all means, if you do, some people do, then they can correct it. For a start, they can correct it. You can just get T3 thyroxine tablets. They'll give you them. And this replaces your natural thyroid back to the normal level, so it's not low anymore. But people with low thyroid do show, on average, this is literally science in studies, that they are 5 to 10 lbs, pounds, plus in body weight, BW. Poor arrow there, never mind. People with low thyroid are on average 5 to 10 pounds heavier than people who've got average or normal thyroid levels. So this is not really changing the world, do you understand? It's more impactful, low or high, hyper sometimes rather than hypo, meaning lower. Thyroid, it's more impactful on your health. It's more negative whether the thyroid's low or high on your actual physical health because it affects every single cell inside your body. It's not really affecting fat loss and weight management as much as some people might think. And what about type 2 diabetes? Another metabolic disorder that you can experience. Well, weight loss and exercise actually has been shown again and again, and my YouTube weekly health and fitness podcast is about to kick off today, and I've got literally a brand new study to show you that's literally come out this week or last week, very recently, about, once again, as we already knew, diet and exercise, controlling, getting rid of insulin issues and medication required insulin issues. So exercise and diet, getting people off insulin dependent medication or insulin medications in general, and getting people back to normal levels in terms of blood sugar and stuff like this. So type 2 diabetes, weight loss is actually great for it. Actually, and it's not really slowing down the metabolism, the type 2 diabetes. It's making it act differently, and there are different complications and considerations, which is why I'm a clinical nutritionist, and I work with people who have all of these. So if you're somebody who has a slow metabolism, if you're afflicted by one of these things and you want help from somebody who understands, please come and contact me. I literally coach people today at Slum Society who have polycystic ovary syndrome, low thyroid, and type 2 diabetes. Some people draw the short straw when it comes to When it comes to fat loss and weight loss and metabolisms, literally, it's not fair. Human bodies are not fair. Like, I can't dunk a basketball because I'm not 6'4". Some people struggle with weight loss. It's literally true. Let's talk about why this is not going to stop you, though. Let's talk about how we can succeed. So I'll make this a little bit smaller so I've got more room, but if your metabolism is slowed down by 20 to 40%, in fact, I'll give you a specific example to work with. Let's say you have a twin, you have a sister, let's say, and you both start weight loss, and let's say you're the same height, you're the same weight, you're as close to the same everything as you can possibly get, except you have polycystic ovary syndrome and she doesn't. Let's say you both start the same dieting protocol and she loses, I'll just write it back on here just so you don't have to remember, 20 to 40% down reduction in metabolism. Let's say your sister starts to lose 2 pounds per week, 2 lbs PW. Let's say you have a 20% metabolic reduction. What's 20% less than 2 pounds? 1.6 pounds per week. So if your metabolism is 20% slower than your sister's, she loses 2 pounds a week, you lose 1.6. Is it slower? Yep. Is it stopping you? Not at all. Let's say you've got a 40% reduction. What would you be? 1.2 pounds per week. Is it fair? Not really. Are you putting in the same effort as your sister? Yes, you are. Are you losing weight slower? Yes, you are. But are you still doing it? Are you still doing the damn thing and making some progress? Yes, you are. What about low thyroid? Again, you can just take your T3. Go to the doctors if you've got low thyroid. Take your thyroxine tablets, your T3 or your T4, T3, T4 combination, whatever it is that they've given you that they feels like the best for you. Do this, and then the metabolism will be back up to the normal levels. And this is not having a massive impact anyway. If you've got 5 stone, 6 stone, people come to me with 10 plus stone to lose, common. It's not the thyroid causing this, I'm going to tell you what it is soon, and it's not the diabetes, it's the thing that caused the diabetes. That's the issue. I'm going to write on the bottom here, I'm going to get my favourite colour because I'm about to talk about my favourite thing. My favourite colour is purple, and my favourite topic is... Can you tell what it is yet? It's calories! Oh my lord! Did you know it was coming? Did you think we were going to get through one of these videos without mentioning calories? Come on. If your weight is not coming down, it's not because the metabolism's stopping you. Might the metabolism be hampering or hindering you? It might be. Honestly, it might be. It might be making it more difficult for you. You might have tried fad diets, meal plans, Skinny Watchers, Weight World. It might not have worked. It might work for other people. Other people are not you. Some people do have faster and better for weight loss, metabolisms, than you might do. So basically everybody who comes to see me who's in one of these positions, they come to see me because I'm a clinical professional nutritionist who actually understands these things. I'm actually a clinical nutritionist trained and ready to work with you on these things. If you're joining a more common weight loss plan that doesn't cater for these things, then it's not working for you. To be honest, I'm not surprised, but it's not going to stop you. If you are afflicted with these metabolic issues, you should contact me and you should have faith and you should keep pushing forward because you are not broken. It can be done. You can and will lose weight if you do the right thing. Whether you lose weight or not, it's down to your calories, like I just wrote. So if you've got a metabolic reduction of any of these kinds or a metabolic problem of any of these kinds, might you lose weight slower than somebody else? Yes. Might it be a bit more difficult? Yes. Might you be a bit hungrier than other people? You might be. Might you need to reduce your calorie intake further than other people to get the same result? Yes. Might you have to reduce your calorie intake further to get any result than other people? Yes. If you reduce your calorie intake the same as other people, might you get a lesser result? Yes. Might you have to work a bit harder to get the same result? Yes. But it can and it will, and it will be done. It will be done. Even if you don't do any extra work, you can just accept the slower results, and then the side effects you're experiencing from the PCOS with dietary and lifestyle intervention can lessen. The type 2 diabetes can be controlled. You can take your thyroid medication. We can get it on track. We can win. This is my message for you of the day. Have confidence, please. It's not your metabolism. It might be causing you issues, but it's not stopping you. So if you think you should be losing weight or there's something wrong because you're not losing weight, it's because your calorie intake's too high. Might your metabolism be affecting your calorie maintenance level? That's what your metabolism is. It's how many calories you can consume per day and then what that does inside your body. Yes, the metabolism, that's a massive part of that, but it's not stopping you. If we reduce your calories correctly in a way that works for you, it can and it will be done. The weight loss will come off, and that's even without doing any of the metabolism boosting techniques we can do. which I've got 30 seconds left on the video, so I've not got time to go into. That's a completely different topic of metabolic boosting techniques. I've done many videos on that before, how we can boost up your metabolism. Because if your metabolism's 20% slower, we can just boost it by 20%. I'm not even kidding. And then things will just go normal once again. You can win. It can be done. Thank you so much. Connor Rhodes from Slum Society. Message me if you want help with any of this stuff. I'll speak to you and I'll see you again soon.